So everybody, we're going to wait a few more minutes for Dr. Martin to join us for our talk today on gut health. Hi, Debbie. Hi, Dr. Martin. Are you added on? Let's see if we can add you. Hey, Debbie. Are you added on? Okay. Debbie, can you hear me? Deb, if you can hear me, can you type in the comment section that you can hear me? Hi, everybody. If everybody can make sure they can hear us. Debbie, are you there, Debbie? Hi, Dr. Martin.
Hi, sweetheart. How are you?
I'm good. Finally, the website's back. Ah!
Oh, thank God. Isn't it the worst? Oh, it's the worst. What'd you have to do?
It's broken, but it's back. I know. Dr. Martin, Debbie, who's on our feed right now, do you see her? What? Debbie, can you hear us? Okay, so Debbie, who's on this feed, her sister is a client of mine. She actually lives in the East Coast. She's one of my Enjoy reps, and I have her on board because the company that I utilize for all of my products is pretty much going the whole route of gluten, soy, paraben free with everything they do. So say hi to Debbie on there. Do you see her? She maybe knows your daughter, since your daughter's Miss Hair Portland, Oregon lady, you know. Woo! Okay, so can everyone hear us? We're going to give a few more minutes because I know some of the ladies couldn't figure this out. But does it show how many people are on the feed? Okay, because you're breaking out pretty much, Dr. Martin.
Sorry. Okay, I'll hold still.
Yeah,
Is that better?
normally I can normally see you better. You're breaking out.
I know. It's
Hi, Stacy.
there. How's that? I have to hold still.
Yeah, do you have a tripod for your phone?
No.
I'm going to send you one.
Okay. I'm very tech challenged.
I think we were
Very
waiting
tech
for
challenged.
Yeah, we were waiting for a few more ladies to join, and I thought this would be easier for everyone so they don't have to call into the Zoom. They're still having some confusion on how to find us. I don't know, because the e-bite that we sent out was pretty specific. So let's give us maybe another minute or two. Hi, Michelle. Hi, Stacy. Hi, Deb. This is Dr. Martin from Oregon, but she comes to Scottsdale soon to help. I need help.
Yes, I'm coming in March. Hold on, little. Sorry, my daughter's bringing.
What is Oh, wow.
Book. This is the book at booklet, plus another stack that's about this high of just mismatched things that I have accumulated over the years that I give to all the students that I train in colon hydrotherapy. But there's so much more information, so much more to give. I kind of wanted to go over some of those things with you today. Some of them we've already covered about, you know, what to do when you're detoxing, the very basic things that people can do. It's all through nutrition. The basic.
Right.
On a farm.
Right.
I know how the cow's tits right as they go by, you know. I've done all that. I get it. What I don't like about normal dairy milk, if you're cows,
Mm-hmm.
enzyme. I don't have the enzymes for that. I don't have the capacity to digest fully and completely all of those enzymes. So why would I want to be putting something in my body in the first place that I don't have the capacity to digest? So to me, that's number 2 in digestion. And the number 2 thing you have to do to detox is to not intake products that you can't break down. And so for people who have genetic disorders like MTHFR, we lack certain enzymes for detoxification. To be able to and I shared with you, Tammy, that back in the 80s, I mean, way, way back, when I used to have a very large colonic holistic practice. We ran 6 massage schools. A partner and I traveled to different states, and we just did everything we could to get people well, and we went by who could sponsor us and who could get us there. And
Right.
we had a client in Aurora, Colorado that was on kidney dialysis. He was up to be have a kidney transplant, and he kept getting put back on the list. The wait list was longer and longer. He couldn't pull it out, and we ended up putting together some protocols for him. One was detoxing, and two was some nutrition. So number three, you have to have good healthy nutrients, and those enzymes have to be in place. So detox isn't just do a colonic or take an herb to get rid of the parasites,
Right.
or do a juice cleanse, or it's a complex, very complex components that you have to all put together. And then if you're compensating for having those gene defects, it's even more serious that you do that. I mean, it's much more important. I had my breast implants for a total of 35 years. In those 35 years, I became a naturopathic physician. I trained with Dr. Bernard Jensen in colon hydrotherapy and became one of the leading hydrotherapy instructors in the United States and now all over the world for all those years. Well, when I got really sick and my implants ruptured and mold spilled into my body, the first thing I knew to do was jump on my colonic system and start detoxing. And I literally did 90 colonics in 90 days. And I know people are like, oh my God, how did you even live? Well, I got rid of a lot of stuff, and it is what I do believe kept me alive. But it was a very serious thing I had to do. Some days I thought I might as well just lay here on this colonic equipment and just, take a nap and not bother getting up because it was too much energy. Yeah. But with that being said, yeah, I know it is a shock. But with that being said, I had to do it. There just wasn't any way about it. It's like if you're going to have your arm amputated, do you want your arm amputated in inch segments, starting at your fingers, working up to your shoulder? Or do you want to just go in at the shoulder and get it done and get it over with? And that was kind of the mentality that I approached it with, was I just have to do this and I have to get it over with. So with that being said, it's a very complex thing. I mean, I cleaned every system in my body. If you're familiar with Ayurvedic medicine at all, that was the majority of my practice. I went through all the systems. I did all of the phase 1, phase 2, phase 3, detox, all of the panchakarma, everything. So it was a very, very detailed thing. However, with that being said, I had 3 doctors review my labs and my tests and tell me whatever it was I was doing was the only thing keeping me alive.
They're saying they can't hear. They're saying they can't hear right now. They're saying they can't hear you, and I can hear you fine. So for the ladies who can't hear, when we do these videos, they're all posted after this on YouTube because I can hear you fine. But if they can't hear, you may want to adjust your ringer settings on the side. Okay.
Mine are clear up. Yeah, my volume's clear up. Yeah, and I really appreciate that you are posting those videos on YouTube because that's very helpful.
Well,
I've referred a couple of students to them.
And the big thing, so for the ladies that are on here, the main thing that we talk about obviously is implants, okay? So we talk a lot about this, but because Dr. Martin and I personally are experts in our field, I'm a hair expert of 34 years and she's skin, body, naturopath, way longer than I've been doing this. But we talk about this as a symptom because we both are also cancer survivors. So after I had my kidney removed, I still wasn't well. And that's the whole point why I'm doing these talks, why I have a TED Talk coming out. and why I'm very adamant in my hair business, because everything that we use is all plant-based. So after the kidney was removed, I actually got worse. And my whole entire life, I've been paleo, which for most of you guys know, that's pretty freaking healthy, right? So these implants that we were talking about, breast implant illness, it doesn't matter what's inside of this. It could be water inside of the bag. We're talking about the physical capsule itself. And it doesn't matter what your doctor's telling you, the capsule itself, the toxic being that we're putting inside. So to move forward on why we're talking about gut health, for those of you who have implants and you haven't explanted, doing a detox is bad news, because you're actually pushing more of this into our cavity, which is in our lymph nodes. So when we talk about detox and heavy metals and gut health, right now, the most important thing, obviously, is to remove symptoms, whatever that may be. But with the gut health,
remove the cause.
Remove
the cause.
And we list this as far as allergies. Everyone has a histamine release in allergies, but we say when we talk about gut health, we have to eliminate 5 things: milk, which we talk about, dairy, gluten, soy, wheat, pork, chocolate, corn. Because as we've talked about these before, and the way that I was raised, and Dr. Martin, I was actually raised in Amish country on a farm. My parents are conservative Christians. We never went to a store. We had the milk delivered in glass jars. And my mother cooked all of our foods from the garden. So everything that we ate was apple cider vinegar and very healthy things back in Amish country, right? So now as we move forward, we can't have corn anymore. So 90% of the food that people are absorbing has wheat, corn, pork, soy, and gluten. So we need to remove symptoms and start working on the gut, which is what we're talking about today. So Dr. Martin, a lot of the ladies are asking me before about cleansing with foods, and I'm trying to explain that doing juicing to me is kind of cuckoo, because if you have an issue with your intestines already, to actually absorb some of those nutrients from the juice, you have to chew that food about 30 to 40 times to break down the cell on that specific plant. So could you tell me your intake on juicing? Because I really believe eating the whole vegetable is more effective if we chew our food and break down that enzyme.
Well, there's a couple of trains of thought there. One, I don't know that juicing is bad if it's appropriate. Appropriate
Right.
is when you're doing maybe a 3-day colonic every month and you want to give the colon a break and put it on vacation so that everything comes out of that colon, then yes, at that point in time, I think juicing is essential, because your nutrients are highly absorbable, and they will be, the cells in our body, they'll be more permeable too. So nutrient will get into the cell faster. But I think you need to not just, chug it down. I think you need to literally absorb it slowly and gently and allow all of those enzymes to benefit you. Now, that's how I do juicing. Now, my daughter does juicing a little bit differently, but there's different times when it's appropriate. But as a diet, as a lifestyle, no. You need to chew your food because it releases the enzymes.
Right.
And your body, your small intestine, needs those enzymes, because that's how it takes the nutrient in. If it's working properly, that's how it takes the nutrient in. You can also detox and take the pressure off of your digestive system by doing things like the far infrared saunas and get the oil sweats going on. And I think Dr. Feng talks about this a lot in some of her videos, how it's very important to get the oil sweats going on and not the water sweats. So you use the far infrared sauna to activate the oil gland, the sebaceous gland, instead of the water. And then she also talks about, and I've always been a big fan of the ionic foot baths,
Right.
because those two things, just those two things alone, they're not the only two things, but specifically those two things will allow the digestive system to not be more stressed. And when you're dealing with really bad leaky gut issues, one, you've got to clean up the damage. You've got to restore the collagen. You have to put the nutrient back in that's going to heal it. So things like our aloe vera, the Select, I like the mango one. Those are the really good nutrients that you start healing the collagen and start repairing those little cells. If you think of your gut lining like a brick wall, and there's mortar that holds each brick together, what leaky gut is the lack of the mortar. And so anything that's passing through the gut literally leaks into the abdomen cavity and next to other internal organs. So your uterus, your bladder, kidneys, your spleen, your liver, all of those things, ovaries, all of those things become very toxic because they're very sympathetic organs to the toxins that are pouring out of the gut. So you've got to restore that leaky gut. Then you've got to get out the plaque and the mucosal ropes and pockets that have been kinked up in there. So I think I have a picture here. I'm going to try to show you. See my little colon picture?
Yeah, did you find the poop pictures? I really wanted to post the poop pictures because I was telling my clients last month, and I don't know if you guys follow my videos, but like, I mean, there isn't going to ever be one thing. And I tell people when they come to me for extensions, this is the deal. There isn't going to be one thing that's going to fix the problem, because I can put extensions in you, but I have to have the hair grow out to have healthiness and have enough protein to hold those strands. So if people don't clean their gut and their liver with me and use my laser and my infrared, it won't even do their hair. End of the story. It's not about money, because in order to wear this, we have to have hair up here. But I was trying to talk to somebody yesterday about the poop pictures that I put up, because I'm going to say this and it may be offensive, but I don't have time to waste because of the cancer and my age, right? So I'm just going to say this. When we evaluate the poop, that's going to tell us exactly what we're not doing right inside, because any of us that are on this video, we all have compromised immune. We have to change that diet, and we have to be key and make it 7 things. I eat 7 foods and that's it. And I look at my poop every time I go to make sure it's the size of my fist, make sure it's not green, runny, choppy, stringy. Do we have those poop pictures, Dr. Martin?
I don't have them on me. I'm so sorry. Well, maybe. Well, hold on. Go ahead. Keep talking.
Can you kind of go over, remember when I posted the poop pictures about dehydration and all of that kind of stuff? Because I think for some of the ladies, people are in a stage of panic and they're trying to do like all of this stuff together when it's pretty simple. I say this, even going back to American diet, it's called SAD, and it is SAD. Standard American diet is horrible because it's not like when we were raised in Amish country. Fruits, by the way, everyone, when we eat fruits, those need to be eaten by themselves and not combined with anything else. If you guys are eating protein, do not combine that with anything else. So basically, when I talk about being macrobiotic, which is what I am, my foods are simple. I eat an apple by itself. I eat my chicken by itself. I have my veggies with maybe my couscous, but food combining is huge, and that's going to affect your intestine, your gut, and how your poop is coming out. So can you kind of go over the poop?
And your pH.
Right. Can you go over the poop?
And your pH.
The poop pictures. Do you know what I'm trying to ask you?
I don't have them, but we can post them in the comments after the video.
Okay.
So yeah, you do want to make sure that your poop floats. You want to go to the bathroom within 30 to 45 minutes after you eat a meal.
Exactly.
And the poop that comes out should be in the size of the meal that you just ate.
Exactly.
So if you ate a 4-ounce fist size full of food, you need to be pooping out a 4-ounce bowel movement. Okay.
Exactly.
Now, most people, when I tell them that, And when I'm doing colonics on them, they say, what? I haven't pooped in 3 days. That's what I hear. Yeah, that's what I hear. So if you've got food that you just ate that isn't coming out, it's sitting in your gut for 3 days. Think of it like this. I just had chicken, I had rice, I had some green beans, I had some peaches. All right, well, go set all those ingredients into a bowl, put a lid on it, put it in the back of the cabinet, just let it sit there for a few days, 3 days, that's what you said you didn't poop in, and go lift the lid and smell and look and see what is in that bowl now. You're going to see parasites. You're going to see worms. You're going to see fermentation. You're going to smell stuff that you never wanted to smell in your life.
Right.
That is what is going on in your gut. And you think for 1 minute you're going to get health out of that? No way. No. You can't make anything that's been sitting in the back of your sink for 3 days covered up. It's the same thing in your gut. Same thing. And if you're a sick person with autoimmune illnesses, thank you, breast implants, then you're not going to process or break down that food. There's no way you're going to do it. Your gut is sick. That's where your nutrients get absorbed. If your gut can't do its job, where are you going to get your nutrients from?
Exactly. And I know that
that's the problem. And when
we were talking with a lot of the ladies, because sometimes I get frustrated sometimes with my practice because I may push certain things for hair, right? But I'm doing that because I know that if we can get the inflammation off the scalp and feed the scalp, same thing with our gut, it's going to actually help our cells to reproduce. But I was talking to one of my clients about digestive enzymes, and I said, yes, pineapple, papaya, spirulina, digestive enzymes that we use are still not going to be able to readily be absorbed into your body if you're lacking the proper nutrients. So we really start pushing the whole food combining, because it's really bad to have all of these foods mixed together. Like, I don't think I've had a pizza in probably 10 years because I don't want to have my protein, my vegetable, and all of that stuff together. So can you explain to them why it's really important to eat every 3 to 4 hours and only have your one food in that specific time that we're eating? Like Starbucks, no.
Okay. Well, it's called proper food combining. I think that is what the search would be if you did a Google search or a Pinterest search. I like Pinterest.
Right.
You don't mix your proteins with carbs. That's a no-no.
Exactly.
You don't mix a protein with fruit. That's a no-no. You eat fruits individually. You eat a melon all by itself. Don't combine it with any other fruit, because a melon has a certain different kind of chemical breakdown in our gut that no other fruit has. So they're essential to us, and we get a lot of wonderful anti-aging benefits from it, but it needs to be eaten alone. Fruits are going to ferment. So remember when I said that you want to add some peaches or some kind of dessert to your mix that's sitting in the back of the sink?
Yeah.
What that sugar does in that fruit is it ferments.
Right.
So imagine if you have bread and you put it put wine over it or alcohol over it, and it ferments. It's going to mold. It's going to turn to sugar, and that's what's going into your bloodstream. No.
So
you cannot live on that. You cannot heal on that.
We talked about this last week because I try and explain to some of the ladies, because some people were getting offended when I try and push them things. And I say, I'm pushing you things because I'm 50 years old. I've lost my kidney. I know this stuff works. And the main thing, if you guys can see behind me, my whole salon is aloe plants. So even my shirt with the plant, because the whole system of the body starts in our gut. So if our gut is not healthy, there's no way you're going to be able to even try and combat things like this. Now, for me personally, because I've been pretty much paleo my whole life, 22 years of having this crap in me, still I wasn't able to fight off the cancer, because we already know we all have cancer genes that mutate depending on where we're at in our life and where our inflammation and our CRP is. Same with constant heart attacks. These people don't even know what their inflammation markers are. And I asked the Enjoy rep. So Debbie, if you're still on here, Martin, our Enjoy rep here, had a heart attack. And I told him, I'm going to help you with Univera because we have a product called Rhizmatics, which is like a vial desiccator. Okay, so it takes like a Roto-Rooter. You have this clogged artery and it starts to get rid of that crap in your arteries so you won't have a heart attack. Well, when I asked him yesterday, because he's a chemist, right? He does Enjoy. I said, what are your inflammation markers? He has no idea what his inflammation marker, because his doctor, who's a heart surgeon, didn't tell him to change his diet. I'm like, oh my God. So I guess what I'm trying to say is I wish there was a way that we could test, except for the whole SIBO issue, so we can explain more to people that balancing their gut is like the major first step in healing all of this other stuff.
Well, think of it. If you have a Thanksgiving dinner going on and all the relatives in the neighborhood is at your house, but you have only one bathroom and that bathroom toilet just overflowed, you're in hot water. It's horrible. So the plumbing issues, even when you build a house, the plumbing goes in first. You put the septic system in first. You hook up to the septic system first. You make sure the exit valve is open first. If it's not, how are the things on the top ever going to come back down?
Right.
And the way our body is designed is that in the gut, nutrients are broke down. And if you've been poisoned by all the heavy metals that are in those breast implant shells, read the list again. We'll post it underneath the comments in this video. And when Tammy posts this to YouTube, she'll post it back in the group so everybody can share it. Go to the original YouTube link and share it from there, though. And you'll see the comments underneath this post. But those ingredients that are in the implants, all heavy metals. I've done hair tests for over 40 years in my naturopathic practice, in my schools. I've taught people to do those hair tests. I have never in my life seen the high heavy metals that you do with breast implant illness ladies.
Right.
It's phenomenal. It's shocking to me. So I really got interested in it. I started offering it at a discounted rate so that I could see more tests come through and try to research this deeper. But those chemicals, the metals specifically, really block absorption in the gut. They're neurotoxins. They deaden the gut. You have to have peristaltic action. Peristaltic action, when you eat food, it's the griping of the colon, okay, that moves the food along. When you have a neurotoxin, it freezes. No nerve response. There's no movement.
Right.
It's frozen. So food does not move through the colon. It only gets pushed through like a choo-choo. One choo-choo goes in, one choo-choo comes out. That's the only way BII ladies poop. And I would say 90% of them. Anyway, the ones that I've talked to. And I've talked to hundreds.
So
I would say close to 500 women maybe by now.
When I go back to this and kind of like to let you guys know that I'm an advocate for cancer awareness, obviously kidney cancer and hair, but the reason why I really came on board with this and Dr. Martin is because I do extensions in Scottsdale. So if that tells you anything, I think I have one person that doesn't have implants, Botox, HCG, whatever else they're doing. And I try and really educate people about HCG because that's even worse and that's oxidative. I get people do what they're going to do, but I say, how is it that every one of my clients, there's something wrong with us, right? Well, we all have implants. So after I had these puppies out, I'm at 390 days since my explant. And I'm going to say this, I have never been able to hike for over 30 years. I actually am back to riding my bike. I rode 40 miles yesterday on my bicycle, and I'm telling you, it's because I can breathe. My chest, this crap is out, and I'm not going to say I'm perfect, because I'm kind of not right now, but I feel 100 times better just since I've had these out. And that's after they removed my kidney. So the whole point of my TED Talk in my book is my kidney was about this size that they took out. I'm finding out that my kidney would still be in my body if I didn't have this shit in there. So that's the whole point of these talks. And I'm proving it with labs and facts, because if you guys don't know the specific name, it's called CRP, and it's your inflammation marker. And that's the only way you're going to be able to tell once you take these out that it really was related to this. So do you want to kind of talk about that, Dr. Martin, and how this is affecting kidneys?
Well, a lot of ladies want to know if there are tests to prove they have BII. My first test that I always tell everybody is to do the hair mineral test. One, because it's a comprehensive booklet that they can do that gives them a lot of facts, a lot of health information, and they're going to have that for the rest of their life. They also will have something in their own private hands to measure their health with, because a lot of the labs will come back and recommend retesting after you try new things, or new protocols, new diet, new nutritional supplements, and you get retested every 3 to 4 months.
Right.
That way you can take charge of your own life. Do not let your insurance company or your medical doctor take responsibility or be your excuse for not getting well. Right. You are the one who has to fight and advocate for yourself. Now, number 2, I do recommend that they have the regular CBC panels with the inflammatory markers. CRP is definitely one of them.
Right.
But also some of the autoimmune things, and allergy testing is another big thing. Whenever I see those high heavy metals come back in their hair mineral test, that tells me they have inflammation. Right. And it is right there in the booklet. It's in black and white. There's no doubt about it. They're being affected. And then you put that in perspective with all the other diagnoses, all the other things that's going on with them. To me, it all tells me cell damage has occurred. When cell damage has occurred because of the toxicity in those implants, you have to remove the cause of the damage, of the poisoning. Just like Dr. Wolfson says, you have to remove the cause of the poisoning, and then you have to heal the cells. That's why when I found the ASEA redox signaling molecule supplement and the Renew gel, I just lit up. My life got back. I lost 35 years with those implants in me. And even though I was 100% better after my surgery, I still dealt with problems. I still dealt with cell damage because nothing was repairing cell damage. When cell is damaged, it's just like you had a hurricane in your house. You have to repair, detect where the damage is, repair the damage, and replace the damage. Your cells are exactly the same way. Detox is the process of detecting the damage, replacing and repairing the cellular damage. And if your gut is leaky, everything, just look down at your belly and look at all of the organs that are surrounding your large intestine, your ovaries, your kidneys, your bladder, your liver, all of those things, your uterus, all of those things are the big complaints and the big organs that women lose because of the implants.
Well, so to cover that, Debbie, can you hear me? Debbie is one of the Enjoy reps on the East Coast. Debbie, can you hear me? Can you type in the comments if you can hear me? Because I do her sister's hair, and her sister has a lot of autoimmune type issues. And I'm trying to explain to people, I'm never going to tell you, hey, go take your implants out and you're magically going to feel better. I'm telling you that by removing a symptom, which is this, and removing the Botox, and removing the mesh implants, and removing the hearing aid, and removing the metal knee replacements, or whatever we're doing, those are all causing a histamine release that's increasing inflammation. So when we talk about gut bacteria, and I talked about you ladies with my infrared box, in 32 years of doing hair, I have never put anyone under a dryer. I have an infrared sauna, and they process in that. And people are asking me, why are you sending me in this box in this room? I said, because it's positive ions and it's helping you detox. And it's actually helping us close the cuticle of the hair because my color is plant-based. So pretty much when I talk about all of this stuff, if we can just get to the root issue and remove symptoms, we can help repair the GI. But when we were talking about that earlier, Debbie, it's called the mitochondria. And you guys can use this verbiage moving forward because Dr. Martin and I are teachers. And what we do is we teach other people out of our jobs. That's our goal, is we want to teach other people to implement what we're doing in our practice. So the mitochondria is the main powerhouse cell that is being replaced daily. Millions and thousands of these little cells that we're replacing. When we start putting this inside and starting doing more Botox, HCG, and having ongoing surgery, that mitochondria is like this. So you're a seesaw. So the seesaw is tipped and we're aging rapidly. So for me to have kidney cancer at 47, living a very healthy lifestyle, so to speak, it's because I actually aged up to about 80 and my mitochondria took a shit and it went down. So that's why I pushed the stuff that I pushed, because I've increased that mitochondria at the cellular level, because I can't go ride 40 miles on my bike because I got up and had an energy drink. It's because long term, I've increased those cells. Do you want to comment on that, Dr. Martin?
Yeah. Well, I too have gotten a little flack for being a naturopath and selling products or selling hair tests or recommending certain things that are advanced technologies.
Right.
But I think they're, especially in the breast implant awareness community, because they just want to provide sympathy. They just want to commiserate together. And my whole life has been about transcending an illness or whatever. And giving people prayers is a wonderful thing. Understanding is a wonderful thing. Being comforting is a wonderful thing. Giving condolences is a wonderful thing. However, don't identify with it. You are not those damaged breast implants or what they did to you. You are not your Hashimoto's. You are not your mold implant issue problem. You are much more than that. So one of the books that helped me to kind of transcend that place was a book by Michael Singer called The Untethered Soul. And he is a Buddhist monk in there, and he's talking about, you are not the problem that you see.
Right.
You are not the problem. You are not the leaky gut. You are not the person who's sick, laying in bed, who can't move, who hasn't interacted with their family in 30 years.
Right.
You are not the person who can't go jogging. You are the awareness of that person.
Right.
And what happens is we get so trapped up in our problems that we forget the bigger picture. We are the awareness of that person. And so when I pull back my energy and I get out of my little self, I call it, my little ego self, that's so poor me, I'm sick, I need this, I need sympathy, I need somebody to commiserate with. When I pull back from that, I say, what do I need to do to fix that? So my awareness shifted and I become part of my own solution. So for me, in over 40 years as being a naturopath, I've never helped anybody that I haven't sold a product to or provided a service to. That's just the facts. So I think there needs to be a little bit more education. Getting your implants out is one step, one step to healing the damage that they caused. You have to not just get all of the symptoms gone, like the neurotoxin symptoms in the breast implant, let's call it a neurotoxin, but you have to get all of the neurotoxins out of your life, the fluorides, the mercuries, the aluminums, the carrageenans, the fluoride, what else did I say? Help me out here, lead. You have to get all of those neurotoxins out of your life to heal. Now realize that those neurotoxins caused damage. You have to fix the damaged cell.
Right.
It's going to take two things. It's going to take building materials and a labor force. Building materials are your nutrients.
Right.
Labor force is your redox signaling molecules, your ASEA products. If you don't have both of them, you're not going to rebuild your house. You're not going to rebuild your body. After that hurricane of implants hits you, you're not going to rebuild unless you have good materials, figure out what needs to be replaced, what needs to be reconstructed, and where to go in with a good skilled labor force. That's why I love ASEA. I can't even sing enough about it. And I know that people are upset and they're turned off and they think that, you know, you just want to make money. Well, of course I do. However, I also got into this business because I really wanted to help people that I identified with because it helped me. That's
Right.
the bigger picture here, folks. You know, so beyond that, I mean, that's why we do what we do. And, you know, I talked with our publisher today, Tammy, and I showed him some of the piles and some of the videos and things. And we have some wonderful ideas about coming up with some correspondence courses to get people certified as holistic health professionals and advocates for healing, and some ideas that we can do. I can do them through my school. And so those are all wonderful things that we can contribute because we've been professionals through this whole journey. Right. You and I have both always sold products to the public. That's who we are. You can't take that away from us just because we had BII.
Well, and the thing is too,
ain't gonna happen.
I'm gonna mention this because Katie, are you still on the video? Katie, are you still on with us? Katie. So Katie, I found on the other group, and I'm going to say this one time only because we're on live video. Breast implant illness isn't the only issue we're having. So when we started our forum, Medically Challenged, I had actually met Katie. Are you on here? Because she's having issues with her mesh implants and the hernia situation. So when we're talking about helping everybody that's medically challenged, we can't help you if we don't advise you on things that we've done. And because Dr. Martin and I have been in our fields for over 3.5 decades, we've already researched the things for everybody to use. I'm not saying that's gonna fix all of it right away, but what we're really trying to do is say, hey, we've already kind of went through this. We've had cancer, we've lost organs, we've lost lives, we've lost so much, and we're trying to help more people. So Katie, are you on? Can Katie hear me? And I know, Dr. Martin, that Katie's trying to sort of work in the lines with Jamie because she's in Michigan. So Katie, are you on the feed? She's in Michigan and she's having a lot of issues with her implant, her mesh implant situation, and also still trying to get her implants out. So to let everybody know, ladies, it's kind of not an easy thing because obviously the human body isn't easy. But if we step back and we go, maybe if we started with like changing the diet with the food combining, remove some of the symptoms, and then got on the gut system we're talking about and tried some other things, we actually can start to repair our quality of life. And in 10 years, we will feel like we're 20 instead of 80 years old. It's kind of what I was trying to say earlier, that most of the other groups are pounding all this information about lawsuits and doctors and surgeons. I don't really, that's not helping me. Helping people like you guys is to repair your quality of life and renew your health. That's what we're all about. I had to say that. Sorry.
Well, I lost 35 years. I'm thrilled to death to be able to sit here with you today and have the energy to do it. 2 years ago, I couldn't have done that.
Right. Debbie, what does your post say? Looks like Christina. So Debbie, so Dr. Martin, because these are my Enjoy reps. So Debbie has sent me her sister, I told you, and her sister has a lot of things going on, and it's kind of hard sometimes for me because I'm not specifically a doctor. HairDoc TK is a brand that I use because I know so much about what I do. I'm married to a doctor and he doesn't know about detox or any of the stuff I'm talking about. So I don't need to be a doctor to be able to help. But what I'm saying is Debbie on here has implants and so does her sister. And I'm telling them, especially if you can validate, Debbie, this is what the problem is. It's not our hair color. It's not our hair dye. There's some dyes that will be absorbed this much into our bloodstream, but hair dye isn't technically going to give us cancer. These are inside of our body attaching to our tissue. And if we can get these out, we can keep coloring our hair because our body's not combating this, which is 37 heavy metals plus more.
Yeah. And then if you are already genetically MTHFR challenged, you're not going to be able to detox like an average person anyway. So you're going to need a lot more support with detox information. That's why I'm putting together the program for, I mean, I've always been training colon hygienists and getting them certified all around the world. And
Right.
I think one of my claim to fames right now is I'm one of the oldest living colon hygienist instructors. But I don't know if I want that claim to fame, right? But anyway, I think there needs to be colon health education that is for the everyday mom and grandmother out there, because we're losing so much information because a lot of people's families are distant. We don't live with our grandmothers anymore. I learned a lot from my grandmother, and then I learned a lot from Dr. Jensen and Mrs. Louise Gettleman. And so those kinds of things, I've had a very rich education in detox, which is the only thing that got me to stay alive.
So I'm really happy to see some of these comments because I keep saying Debbie she is a close snowflake to me because of the situation with my salon, and people have said kind of not smart things to me, and they've actually asked me. My best friend had died 2 years ago from breast cancer. She was also another hair extension advocate. We owned a company together for 40 years, but check this out. She's had probably over 47 surgeries to the point of, I can't even explain to you, liposuction, all kinds of stuff. So when I got my implants, I'm going to say this, my implants weren't because I didn't feel like I looked fine. I actually was on Baywatch in Hollywood. I was pursuing my career and I was told to get the implants. So when it comes to my salon and hair things, I have to just keep telling people none of that stuff has ever affected me, my health, or my clients. It literally was getting these out. I'm going to keep saying that because now that these are out, I may have been able to save my kidney. That's what this is about. We're trying to be proactive and preventative. So for Debbie on the comments, Dr. Martin can get you the tests that you need and or recommend the ones you need. A medical doctor is not going to do this. It's going to have to be a naturopath, period. Dr. Martin, do you want to add on to
some medical doctors can order a hair test, but you'll also pay for the copay. And then you're going to go to a medical doctor who doesn't do them all the time and isn't familiar with them. Like they don't understand what is the difference between a breast implant high metal or somebody who worked in a coal mine high metal. There's a big difference between where the person's background and history comes from and the protocol of recovery comes out of. So right. That's one thing. And then they're going to have to pay another office visit to pay the doctor. And if you don't have insurance, then it's even going to be twice as expensive. I've had a lot of women coming to me who are paying over $500 in a doctor's office for their hair test, and I'm only charging them $139. When I was in practice, it was $250 for the initial test and the follow-up office visit to go over everything. Well, now right. I'm down to $139 for the hair test, and then we do the full interpretation booklet, and we do the follow-up phone call.
Okay, so Dr.
So
Martin,
I'm basically cut prices so that I can continue the research.
I didn't realize this, Dr. Martin. So Deb, also you have a bladder mesh. I didn't realize that. You need to network with Katie, who's on this feed, because she's having the same issues with that. My best friend in Oregon, who Dr. Martin I was talking about, who did my websites for years. I love this guy. He had part of his colon cut out because the doctor had no idea what they were doing. They put a pig mesh implant in. He has Crohn's now and he's on his deathbed. I had sent him aloe, digestive enzymes, KM, and our essentials, and he's actually doing 100 times better. His doctor just called me and asked me what scope of practice I'm in. I'm like, I'm a hairdresser. But what I'm trying to say is the mesh implant is almost the same as having this. It's causing a histamine release. If it's pig skin, I'm not sure. And I only know this because my web guy was my best friend. Once they put that mesh in there, it's killing his colon. The guy can't barely absorb anything. Can you talk about that, Dr. Martin, about the mesh things that they're doing, the mesh bladder implants?
Anything that's a foreign body. Yeah, anything that's not native to our body. If they're not, you know, taking your skin from your hip and putting it on your face because you had a burn, you're going to have problems. And then if you had to have your skin grafted, you'd still want to have certain high protocols. Several years ago, I almost went to work for MD Anderson as a detox specialist down there. And then I also almost went to work for several other plastic surgeons. One of them was doing burn victims, and they get addicted to the pain medication. So my job was going to be going in there, getting them off the pain medication so they could heal, and their graft for their skin grafting after they had been burned would take. So if you're doing anything like pain medication or neurotoxins, you're not going to heal. You have to stop.
Right, and Debbie just commented the recall. So to say this, Debbie, almost all of it, these were actually recalled 4 times. There's a couple other things because I have to be careful what I say because I'm married to a surgeon. Most of the doctors doing those types of things don't know the same things, say Dr. Martin and I know, because they were never taught that in school. They're taught to fix the problem, do the surgery, and that's it. After my kidney was removed, I asked my urologist if I should be on a special diet or anything. He didn't even know what I was talking about. I said, I'm not going to have pancreatic issues or diabetes because you're removing my kidney. Well, within 7 months, I lost my vision, my hearing, my teeth went, and now I have pre-diabetes. So thank goodness for the Univera that I have. I won't be diabetic because we have things to fix that. But the point is, most of the doctors just don't know. So we can't really be mad at them. It's that they don't know and they're not going to learn because that's not where they make their money. They're not going to make money doing detox like what we're doing. Right? Do you agree with that?
No, that's not where the money is. I spoke with an office manager of a naturopathic clinic this morning, and she said the doctor I work for sees a lot of cancer patients, and that's where the money's at for him. And
nice.
they don't want me to talk about the remedies for cancer because they don't make money on the remedies. They make money on the little baby steps and the bigger tests. So you have to understand the mentality. But the bottom line is, I'm not here to bash a doctor. What I am here to say is you have to be your own advocate. Most doctors learn from you. And there is a big difference between a doctor and a healer.
Right. So I also know, Debbie, if you can hear me.
Try to identify that.
Debbie, can you still hear me on there? I know because you're out there in New York, I want you to visit Dr. Fang's website. And again, we don't promote surgeons or any of that, but that's where I want you to kind of go read through her website. Because now that I'm seeing your feeds, and if you already have mesh in there, I'm sorry, these have to come out. They have to come out because this is releasing so much inflammation. And I can just tell you, if we actually tested you right now, I bet your CRP is probably 3 times the normal rate from just having this inside. So with that being said, Dr. Martin, do you want to add on to anything before we finish up the call?
The only thing that we really haven't talked about is the pH.
We're going to do
and
that,
keeping your pH high.
But we're doing that in next week's because that will be episode 5 for.
Okay, well, teaser then. pH is important.
So if anyone else has any questions, we're going to log off. This will all be posted on YouTube. And the reason for that is none of these comments will show up on my YouTube because we don't want that to happen. So every Monday at 4, we're going to be labeling these episodes for everyone to find. Next week is going to be about pH, because I'm just going to say this. Crazy. I had someone come to me with Keegan water yesterday, and I said, you know that I'm married to a doctor. My best friend's a chemist. I kind of like research queen. He goes, well, do you know this is going to help change your gut? I'm like, oh my God. So I can't wait to talk about pH, because it's going to be about foods that we're eating that are going to change the pH in our blood. Right, guys?
Yeah.
Can't wait. Woo.
Yep.
All right. So everybody today, Dr. Martin, I want you guys to all do one thing. What you start tomorrow is tomorrow, I want you guys to try and work on this food combining. We're going to type a list. Make sure you get the specific tests that you need so you can get proof, facts that you can see, feel, and measure. Because with both of the companies that we work for, we have a 90-day back guarantee. So if you don't see, feel, and measure results, then you don't waste your money. That's what this is all about. It's about helping everyone to be your own superhero, hence for the charity superheroes. And we're giving you the tools that you can do that. So thank you everybody for joining. And we're going to type in some of those lists. And if you guys could do me a favor and private message Dr. Martin with some specific things so we don't do it on the group. So private message her for the testing and all that. Can you guys do that? And thanks everybody. And remember,
All right.
you too
Good night.
can be your own superhero. Peace. Bye.
Advocate for yourself.
Bye.
Bye-bye.
Bye.